Authorities, as we've just been reporting, have identified these 2 clusters. What's your assessment as to how those clusters are likely to grow from here? Is one more of a concern to you than the other?
It is very difficult to say how much they're likely to grow, but given that there has already been some transmission in both those clusters, it may mean that there's likely to be more. Now, the close contacts of cases are the ones most likely to get infected, and that's where the new cases today came from. And so that's an indication of, well, I guess some potential for further spread, because in some situations, close contacts of cases don't get infected at all, and that's a good sign.
Yeah, so the good sign that the health authority is really trying to stress today is that the cases at this point are linked. There are no unlinked cases, because I guess that's when health authorities really do start to worry, when we start seeing unlinked cases popping up.
Yes, that's right. Although it is worth noting that they're really not sure where the nurse acquired their infection from. So to some extent, you could say that wasn't linked. But certainly it was reassuring that the cases notified today were all close contacts of previous cases. But having said that, they're the people that are most likely to get tested. So again, it really does strengthen the importance of people getting tested if they develop symptoms.
And also highlights the importance of people, especially our frontline health workers, getting vaccinated. As you mentioned, the nurse involved in this case, we know that she wasn't vaccinated. She'd been on holidays when the vaccination had been occurring at her hospital. From your perspective as an epidemiologist, looking at transmission at these health points, how disappointing is it to learn that despite the vaccine being in Queensland since February, this rule dictating that only vaccinated health staff can work with COVID patients is only kicking in from tomorrow?
Yes, that is disappointing. I guess, it's easy to say that from the outside. I suppose the reality of trying to manage hospital staff with people going on sick leave and all sorts of things may mean that it might be more difficult than it sounds. But certainly it's reassuring to know that this rule is coming into place.
Linda, how likely do you think it is that the lockdown will end as planned at 5 p.m. on Thursday?
Oh, I hate to look into crystal balls, but, I think it really does depend on whether or not we have learned of any more new cases, particularly those that can't be linked. That will be the key, I think, in terms of a further decision. If there are unlinked cases popping up, then I think the chances of a further lockdown will be much higher.
Linda Selvey, appreciate your expertise. Thank you so much for joining us on Newsday.
My pleasure.